Hi everybody, Dr. Daniel, and today I'm talking about, can migraine kill? Well, consider this. The patient says the headache is so severe, he feels so sick. He cannot get out of bed. He can't eat. He can't see. All sounds make everything worse. His terrible nausea throws up all of his last meal and then starts retching bile. Can migraine headaches lead to death? Because migraine sure feels like death. Well, the bottom line is that migraine headaches do not usually cause death or brain damage directly. Young women who have migraine with aura, who smoke, and are on a high estrogen dose are at risk of stroke. Migraine with aura can result in an increased risk of death due to cardiovascular disease. But the question is, has the risk of death ever been studied for migraine patients? Yes, a large-scale study was done in 2020 entitled Trusted Source in Women, and they found no link between migraine and all-cause death. This included migraine with or without aura or a previous history of migraine. The term all-cause death refers to all deaths that occur in the population regardless of the cause. It was performed by Rahman et al. The name of the journal article was Migraine, Headache, and Mortality in Women, a cohort study. And it was published in the Journal of Headache and Pain, Volume 21, number 27 in 2020. An abstract from that states that migraine causes a high global burden and disproportionately affects women and has been implicated as a risk factor for a cardiovascular disease. Migraine with aura has been consistently associated with increased risk of cardiovascular mortality. However, published evidence of relationships between migraine or non-migraine headache and all-cause mortality is inconclusive. Therefore, we aim to estimate the effect of non-migraine headache and migraine as well as migraine subtypes on all-cause and cause-specific mortality in women. And what they did was they had 27,844 women study health participants aged 45 or older at baseline who were followed up for a median of 22.7 years. And they included participants who provided information on migraine, who had a past history, migraine without aura, or migraine with aura, or headache status, and a blood sample at the start. At the end of this, they had a committee of physicians who evaluated the reports of incident deaths and used medical records to confirm deaths due to cardiovascular disease, cancer, or female-specific cancer causes. They used multivariate proportional hazards models to estimate the effect of migraine headaches. The results was comparative intervals without headache, no differences in all-cause mortality of individuals suffering from non-migraine headache or any migraine were observed after adjustment for confounding. And there was no difference observed for migraine subtypes or all-cause death, which is great to know. But what is the relationship between migraine and heart disease? The American Migraine Foundation said that migraine can increase the risk of stroke, coronary events, and other related deaths by roughly 50%. It may also double the risk of heart disease from reduced blood flow. It's not well understood how migraine and cardiovascular problems link together, but it may be due to inflammation, altered platelet and blood clotting, and atherosclerosis, which is the buildup of fat in arterial walls. The American Migraine Foundation states that stroke can also happen outside of migraine headache and occurs more frequently in people who have had migraine previously. Can migraine headache cause permanent brain damage? The American Headache Society stated that migraine does not result in long-term brain damage. The organization references two population studies that took brain scans of people with and without migraine to study the long-term effects on the brain. After 9 to 10 years, researchers found white lesions on the brain in some individuals with migraine, but these changes had no link to any changes in cognitive or brain function. The American Migraine Foundation also confirms that research has found white matter lesions in some persons with migraine, but that these lesions usually have no link with cognitive decline or neurological problems. The white matter lesions are called T2 microvascular disease by neurologists or neuroradiologists. What are the complications of migraine? Well, you can get status migrainosus, which is a severe unrelenting migraine lasting more than 72 hours, which renders the migraine patient in severe pain, makes him disabled in bed, nauseated, and vomited until he's dehydrated. The pain is usually one side of the head, throbbing, severe, that is over 7 on a scale of 1 to 10, with associated inability to be up and sensitivity to light and sound. By being severe at 72 hours, it's likely that the headache has not responded to treatment, but the factors here are late application of a triptan or use of over-the-counter drugs if the patient doesn't have a doctor to prescribe effective treatment is what leads into this thing called status migrainosus. There's also migrainous infarction, which is the occurrence of an ischemic stroke during a migraine attack. Migrainous infarction is a stroke that occurs during a migraine with aura attack, and strokes can be differentiated into hemorrhagic strokes, which have the presence of fresh red blood in the brain, or ischemic stroke, which means the lack of blood in the brain, either due to a blood clot in an artery, which is called embolus, or closed-off artery. Migraine may cause an ischemic stroke or infarction during a migraine with aura attack. An ischemic stroke happens when a blood clot causes a blockage or narrowing in an artery that connects to the brain. There can be persistent aura without infarction. This is a rare type of migraine with aura event. The migraine aura persists in persons with this type of migraine. Aura occurrence may last for months or years with no signs of stroke. These people need to be neurologically assessed also. There could be migralepsy with migraine aura-triggered seizure. Rarely, a migraine attack with aura will trigger a seizure. These typically occur during or within 1 hour after the initial migraine attack. And that may be treated with a seizure medicine that treats both migraine and a seizure, such as valproic acid or topiramate. There's warning headache symptoms which should be evaluated. These are called thunderclap headache, which is a severe onset headache that reaches peak intensity within a few minutes. And these may be benign, but they may also signify aneurysmal rupture. Positional headaches are headaches that change in intensity with positional changes, such as standing up from lying down. Exertional headaches that come with a cough, sneeze, or straining at the stool. New onset headaches, especially in persons older than 50, are persons with previous cancer or blood clotting disorder. A change in headache pattern, such as an increase in frequency or intensity of headaches. The occurrence of unusual symptoms with headaches, such as weakness on one side of the body, change in consciousness, change in vision, difficulty walking, fever, chills, weight loss, or night sweats. In summary, then, migraine headaches feel severe, but they're usually not life-threatening and unlikely to cause death or long-term brain damage. God bless all you folks with migraine. Please click on subscribe and like down there and follow me, and I'll see you again on the next talk.